I'm Dr. Craig Escude, the host of IDD Health Matters, a podcast where we talk about health, wellness, and health equity for people with intellectual and developmental disabilities. Hope you enjoy it.
Welcome to this episode of IDD Health Matters. Our guest today is Lisa Burck, someone I've known for quite a while who works in the field of IDD services and supports. Tell us, first of all, welcome, Lisa.
Thank you.
So tell us what you do in this field.
Oh my goodness, that would take the entire time. It's whatever needs to be done on that particular day. Yeah.
That's what a lot of people do in this field, right? Yeah. Whatever needs to be done, especially direct support professionals.
Yeah. I have the privilege and blessing of working for the ARC of Mississippi, who is primarily an advocacy organization. So on any given day, you may be investigating an abuse case. We may be training direct support professionals through the direct course curriculum. We may be providing Christmas through our Archangel program to folks who live in regional centers. We have an addiction program for folks who've moved to community, but we're never in that just say no or dare or red ribbon week and have found the wrong first friend when they've moved to community. We do supported decision-making all the way through to guardianships, but mostly the phone will ring from a family member or somebody who's trying to be helpful to say, we don't know what to do. You know, we need a next step. And Mississippi is small enough that I certainly don't know the answers, but I certainly have good friends that I can call and ask questions of, and they usually pick up the phone.
So I mentioned that Lisa and I have known each other for a while, and that's because I spent most of my clinical career, all of my clinical career, really in Mississippi, and that's where we got to know each other, and I got to know a lot about the ARC and the incredible work that you all do there. And I know one of the things that I was really excited to see is when supported decision-making kind of came into the world there in Mississippi. Would you talk a little bit about that and help everyone understand what is supported decision-making?
Certainly. Well, it is a least restrictive option to guardianship, and it is whatever it happens to be for that particular person. Mm-hmm. With most things that we do at the ARC, we start with discovery. Who are you? What's going on? What do you want, but what do you need? And how do we get you to a better place? And so we actually were asked to become supported decision makers in Mississippi from the Department of Justice when they came to see us a few years back. Mm-hmm. And they discovered that people in positions of power were actually also guardians for the folks that they were responsible for. So the ARC stepped in. We brought in Jonathan Martinez, who is the expert in supported decision-making because of his work with the Jenny Hatch decision. And we jumped in not knowing what it was going to look like or what we should be doing, but just in the effort to get to know people, to understand them, to value them, and to figure it out for each person, one person at a time.
You know, I like what you said, that it's different for each person and it's whatever the person needs. And I always like to kind of bridge the gap or the mental gap that we have sometimes when we think about people with disabilities and people that don't have disabilities and thinking that, well, these people need support and these other ones don't. And that's not the case. We all need support, and we all ask for support in decisions that we make. We talk to our family, we talk to our friends, we talk to colleagues who have experience. It's just a different level of support. Some people need a little more, some people need a little less for certain decisions. And that's basically what supported decision-making is, isn't it?
We don't even use the word independent anymore. I don't know a single person who's independent. We're interdependent.
Yes.
You know.
Yeah, great way of saying it.
Our life is relationship. And so you and I may look for us like consulting a physician for the particular need we have. Or if you have a financial problem, you're going to go see your banker or your loan officer. If you have a mental health crisis, you're going to go see somebody in that realm. And so we use supported decision-making every day. But we have a bad habit in this field of creating new phrases or artificial words, or even making something out to be bigger than it is. For example, if you and I do something other people don't approve of, or we get angry, or we act out, we've had a bad day.
Yep.
And we try and do better, and we put it behind us, and we hope a minimum number of people know about it, and we move on. But when the folks that we care so much about and support have a bad day, they now have a reputation. And it's documented, and it's reviewed by every staff member that comes in, and it follows them the rest of their life.
That's exactly right. And so many times the reason that a person has a bad day is because some of their needs aren't identified or not being met, from medical needs, from healthcare needs that are frequently missed, which is what I talk about a lot, to environmental needs and social needs that, again, we all have. And, if you aren't able to, say, to communicate something using words, you're going to still probably figure out a way to communicate it. And that sometimes might mean you need to do something to get the attention of someone. And we frequently might label that as, well, they have adverse behaviors and we need to do something to stop those behaviors, without ever looking at why this person is having these behaviors.
That's right. I was able to do an internship at the Helen Keller Center in Long Island, New York, and I learned about a man there who was totally deaf, totally blind, been kicked out of a number of places, and the Helen Keller Center was probably his last resort, and it was because of his adverse behaviors. Mm-hmm. And one in particular, he would get up every morning and he would make his bed, clean his room, get dressed, do all the things that we do typically. And then he would take his shoes into the bathroom and he would fill them full of water. And he would bring them back into the bedroom and he would pour them into the bed. And so the great staff at HKNC didn't see that as a reason to leave. They really firmly believe that all behavior is communication. Mm-hmm. And so then they sought to figure out what it was he was trying to tell them. And it was a direct support professional who very astutely noticed that there was one day a week that he didn't do that. And wow. That was the day that he got clean sheets for his bed. So when they sought to know him a little better, they learned that he'd grown up at Willowbrook, the most notorious institution in our American history. And not only had he not had the privilege of clean sheets, he probably didn't have a bed growing up. So the solution was to hand him 7 sets of clean sheets a week, and there was never another issue.
So he was cleaning his sheets.
He got his needs met.
Yeah. Interesting.
Yeah.
When you take a little time and think through things, it's amazing what you can discover.
Well, and post-COVID, an important part of all of our lives is what purposeful things we do during the day. And employment is the most purposeful thing. And employment gives you more money. You know more people. You live larger. You're healthier. Mm-hmm. You live longer. And so COVID really just destroyed the employment supports in our country for folks who experience disability, because the staff shortages mean that instead of employment, which usually means one-on-one, I can take that staff person and put them into a residential setting or a day setting, and they can serve 4 people, 5 people, 6 people. And so I'm getting a bigger bang for my buck because I just don't have enough DSP staff to go around. But that has decimated the employment world. And so in my personal opinion, as behaviors have just escalated off the charts, nobody's connecting it to the fact that we've taken away purpose.
Friends for Life Residential Care, specializing in support for individuals with developmental disabilities, offers services like adult day support and home health care. Emphasizing empowerment and quality of life, we live by the motto, "My ability is stronger than my disability." We are currently hiring, welcoming those passionate about making a difference. Learn more and explore career opportunities at friendsforliferc.com.
I'm Dr. Craig Escude, President of Intellectability. State developmental disability agencies, managed care organizations, and providers across the United States use Intellectability's health risk screening tool, e-learn courses, and person-centered training to improve health equity for people with IDD. Visit replacingrisks.com to learn more about how you can employ these tools with people you support.
Yeah, that makes sense. That makes a lot of sense, actually. Yeah. Well, you're connecting the points there, and we need to get that story out more. Yeah?
That's the right thing to do.
Yeah.
You know, I once heard a man by the name of David Pataniak, who is just a wonderful psychologist, and he told a story about pontificating on the stage and using big words and the phrases that we use in this field that nobody else knows. And at the end of his speech, a mother came up to him and she said, "Look, I really respect your education and your experience and your intelligence, but I just can't bear the words special needs anymore. My son doesn't have special needs. My son has the same needs your son has. To love and be loved, to be safe, to have good food, a decent roof over his head, purpose, family, relationships, responsibility." How we get there looks different, but the need is not any different.
That is very well said and quite profound. And that's something that direct support professionals have a big role in when they're supporting people with intellectual and developmental disabilities. Tell us about your background. How did you come into this field?
Oh my goodness. So my husband was in the United States Navy, and we were told to come to Mississippi for 6 months, and then we were going on to where we were from, which was California. We thought we were going home, and I needed a little job, and so I answered an ad in the paper for something called a sheltered workshop. Didn't know what that was, and had never known a person with an intellectual disability in my entire life. We raised our children on bases where everybody was between the ages of 19 and 38 with 2.3 children, and they were healthy, and they were mission oriented, and my kids knew no one who was old. They didn't know anybody who was different, and what a skewed way to grow up. You know, we didn't even know how awful that was, and so took what I thought was a temporary little job, found out the very first day that this is where I want to spend my life, had to go get some education to go with it, and it has blessed me every day.
You know, it's a story I hear a lot and experience myself. This field, many people fall into it kind of accidentally, and you know fairly quickly if it's for you or if it's not for you. And if it's for you, you're in it for life. If it's not for you, it's not for you. Everything's not for everybody.
Well, unfortunately, if it's not for you, you don't always leave. And that's important.
That does present challenges sometimes.
Yes, we'd love to help you on to your next career. You know?
Right. That's right. So Lisa, one of the things that I always ask guests is to tell us 3 things in 3 minutes. I'm not going to hold you to 3 minutes, but 3 things that you would like listeners to know about Anything you think that could be related to improving supports and services and health and wellness for people with intellectual and developmental disabilities? Do you have 3 tips, 3 words of wisdom that you can share?
Well, we'll see. I'm not sure. Okay. We're here sitting at the annual conference for the National Alliance for Direct Support Professionals. Yes. It has been an amazing time, and folks come away charged and purposeful, and with a better understanding of what they know and what they need to learn, and why they do what they do. And so the founder of NADSP was John F. Kennedy Jr., whose Aunt Rosemary had intellectual disabilities, and because of a bad medical procedure, was then only able to live in a group home setting for the rest of her life. And so John Kennedy Jr. came up with just the mission of NADSP, and it's about quality. And the quality is defined at the moment of interaction between the giver and the receiver of supports. So primarily at the Arc of Mississippi, we're advocates. I don't have control over who you hire, how much you make, the color of the paint on the walls, but I do know that we can find a way to impact that moment of interaction, because probably point 2 is that the quality of somebody's life depends on who walks through the door and what kind of a day that they're having. And that's enormous power.
That is.
And we don't recognize it like we should. We don't pay as we should. I remember speaking with some legislators the other day and telling them that the folks in Mississippi and other places can go to a fast food establishment and make more money per hour. And the worst thing that can happen is that they'll burn somebody's lunch.
Right.
With direct support work, it could be life or death.
Yeah.
And we don't pay them what it takes to flip a burger.
I could not agree more.
Yeah. And then just lastly, just the value of the relationships. This same person that I quoted earlier, David Pataniak, says the only real disability is loneliness. Mm-hmm. And we make poor decisions based on that. We don't see that as a part of our mission in helping people live full and supported lives. And we just have to build some empathy into the folks that have that power over folks. You have family, they need family. You have love, they need love. You have purpose, they need purpose. And we create learned helplessness sometimes by over-serving people. And I think we need to do better. We have a long, long way to go.
We do have a long way to go. We've made a lot of good strides, so I don't want to not leave that out, but we do have a long way to go to improve services and supports in this field for sure. Lisa, your compassion is evident. You are a gem in this field, and I am very happy to know you and to have known you as long as I have. Thank you so much for taking the time to talk with me today, but more importantly, for the incredible work that you do in this field.
Well, it is my blessing and my honor, and thank you. I count you as a good friend.
Same here.